Nick Dole's here, practice manager of the Dole's Clinic in Birmingham, Alabama, and certified nutritional pain consultant. Back in March of 2017, the Dole's Clinic made available to its patients a hemp oil extract, a CBD product that we were curious to see if patients would benefit from. Several years later, a lot of people have hemp oil extracts, CBD. These products have become a big market topic. A lot of patients who are dealing with pain and other chronic conditions are curious about these products. The problem with this, as is the case with many dietary supplements, is that you may not know what you're getting. You may not know what to buy. You may not know how to determine if who or where you're buying from is a good, reliable source. So today what I want to do is give all of you a little bit of information based on our experience and our research that can guide you when you're making a decision about which product to try. So A, you can make sure that you're getting what you pay for, and B, you can make sure that what you're getting is safe and in accordance with what you and your doctor have discussed. Now, the first thing that I think we really need to talk about is the difference between hemp and marijuana. All of these products come from the same basic plant, the cannabis sativa or the cannabis indica. The difference between those two is really where the plant originated from, but the chemical structure is essentially the same. Now, up until 2018, we had products that were used, that were made out of hemp. They were part of the textile industry. A lot of us are accustomed to seeing bracelets made out of hemp or purses or handbags. We've seen these things, so this was a dried plant used to make some type of fabric. Then there was marijuana. Marijuana is now a part of several shops in states where it is legalized or at least decriminalized in some form or fashion. The reason that this is an important topic is because at the end of 2018, the Farm Bill was passed. Now, what the Farm Bill gave us was a definition. What the Farm Bill states is that a cannabis plant that is grown to have equal to or less than 0.3% THC by dry weight is considered hemp. A cannabis plant that is grown to have more than 0.3% THC by dry weight is considered marijuana. For those of you that may or may not know, THC, or tetrahydrocannabinol, is one of over 100 active cannabinoids in the plant. It's the one that's most recognized for causing a sense of euphoria or a high. Now, what is legal in many states is hemp. What is still considered a controlled substance, a Schedule I controlled substance by the government, is marijuana. Now, this is important to understand because when we're looking at a product, we want to make sure that what we're purchasing is hemp. So we know that we want to make sure that we're looking for a hemp extract. Now, one of the best ways to determine that you're purchasing a hemp extract is not only to look on the bottle for the words hemp oil extract or industrial hemp extract, but also to look at the manufacturer, look for contact information on the bottle, try and figure out where that bottle came from. If you call these companies, good ones will make available an independent laboratory result. Now, why is that important? Because some companies may stamp a label on their bottle that isn't exactly true. You could be buying a product that is marked as hemp oil extract, but when you look at a laboratory result, it has more than the legal amount of THC, meaning it may be marijuana. Now, you can put yourself in a precarious situation with this because you may or may not be drug tested depending on what your circumstances are, what doctors are involved in your care, your job. All of these things may dictate who looks at your blood or urine samples. And we want to make sure that if we're taking something that we're staying within the guidelines of our state, the federal government, and our employers. So again, reach out to companies, ask for third-party laboratory results. What you should be able to get is an independent laboratory result that confirms that what you're taking has less than 0.3% THC. If it has more, I would suggest you avoid that product. If you contact a manufacturer and they say that they don't make those testing results available, I would suggest moving on and looking for a different company. So within the world of hemp extracts, there are a couple of key terms that can be very confusing to some patients. There are three things that I think are important to look for, and it all depends on what it is that you want to try. So it is possible to isolate individual cannabinoids. If you remember from earlier discussions, there are over 100 active cannabinoids in the plant, THC being one of them, CBD being another one. In the market, a lot of the hemp products that are available are marketed as CBD products. We see things like CBD oils, CBD gummies, CBD drops, a lot of CBD products that are available. So it is possible to have a product that contains CBD and no other cannabinoids. It is an expensive process to isolate this one cannabinoid, but it is possible. And it is a good route to take if you're just testing the waters. The reason that we like this is because it should contain virtually no THC. It should contain virtually none of the other cannabinoids if you've bought a good product. This gives you an opportunity to test something that is safe and potentially effective at a higher dose. When we start looking at things that are extracts that contain all of the other cannabinoids, understand that you won't have the same amount of CBD with all of the other cannabinoids because the tablet itself can only be so big, otherwise you wouldn't want to take it. So as we have one caplet size, when we add more ingredients, the amount of each ingredient has to be smaller. That's just an important consideration to keep in mind if someone has told you, hey, you should try CBD. Or if you've done research and you think to yourself, you would like to try CBD, it may be in your best interest to look for a CBD isolate rather than a broad spectrum or a full spectrum hemp oil extract. And we'll talk about what these mean in a moment. Broad spectrum hemp. This is currently defined as a hemp oil extract that contains all of the cannabinoids except THC. So this is an opportunity to take a product that has all of the cannabinoids in small amounts, but in a safer environment, something you don't have to worry about. Again, you should be able to get independent lab results that confirm no THC. Now, what might be the benefit of this? We discussed a little bit earlier on that the tablet size that you take or the drop that you take is only going to be so much. It can only be so big. So it can only contain so many milligrams or so much of any given ingredient. So when we take all of the cannabinoids, over 100 of them, and we've only eliminated one, we're really limiting the amount of each one that we're taking. Now, whether or not that is a good thing or a bad thing is really up to the individual. All you can do is try and give it a shot. A lot of people do really well having more CBD. Other people do really well having more of the cannabinoids, even if they're all in a smaller amount. It's really up to you. This is a trial and error process. It's hard to say that one diagnosis or one type of pain does better with one type of supplement. Really what we would encourage is to start with CBD. If you don't get benefit after a couple of weeks, then maybe move into broad or full spectrum, depending on what you and your doctor have discussed. Full spectrum hemp oil extract is now the combination of the two. We have all of the cannabinoids, including THC. This is an area where those third-party lab results are crucial, very important, because in certain states, full spectrum hemp extract is legal as long as it contains no more than 0.3% THC by weight, as long as it is actually a hemp extract, not a marijuana extract. So again, this is a step that you can take. Whether or not that small amount of THC is going to provide any benefit is hard to say. Now, do understand that at this point, the cannabinoids have been determined to be mostly safe. There's not a lot of research available out there to say that it is not effective or it may cause long-term negative side effects. For the most part, these products seem to be safe, certainly from the discussions that we've had with various people in and outside of the clinic. However, when we talk about a full spectrum hemp, even if we're within the guidelines, understand that it's a certain percentage by weight. What that means is that if an individual were to take enough, that percentage could be a certain amount. It gets higher every time more is taken. That's where we can get into an unsafe condition, and that's where I would want everyone to be very cautious about what they're taking and how much they're taking. These products can be very expensive, and usually that is the limiting factor for how much individuals can take. But still, we want to be very cautious when we move into products that contain any amount of THC. Understand that even a small amount can show up in a urine drug screen. The last thing that I want to talk to you about today is value. So when you're looking at different products that are on the market, it can be hard to determine what is the best buy. Oftentimes we pick up products and they cost less for the same number of tablets, so we think we're getting a better deal than what someone else down the street may be selling or making available. But it's important to understand that your money should be spent on what you're trying to buy. We've seen products that contain CBD and then they also have caffeine added to them, or they have other things added. So the product becomes less expensive, not because it's a cheaper product, but because it has less of the ingredient that you were trying to buy. This is a very important thing to pay attention to, and I would say this is a good take-home message no matter what nutritional supplement you're considering, whether it's a protein powder or a vitamin. Think about what you want to spend your money on and determine if that is actually what you're spending your money on. Now, what we have here is a simple equation that I'll walk you through to kind of determine whether or not you're getting a good value, or at least give you an opportunity to price compare. If we look on a bottle of a CBD isolate product or a hemp oil extract product, what we'll see is a total number of milligrams per serving. It will say that on the nutrition label on the back of the bottle, you have X number of milligrams of either CBD, full spectrum, or broad spectrum hemp oil extract. If we take the total number of milligrams per serving and we multiply it by the number of servings, most bottles will have 30 servings, we end up with the total number of milligrams of CBD or hemp oil extract in the bottle. Now, if we were to take the cost of that bottle, the total cost, say $80, and we were to divide it by the total milligrams of hemp oil extract, we would determine our cost per milligram. This is very important because you may have one product that is $80 but contains 25 milligrams of CBD isolate. Okay? You may have another product that is only $50 but contains only 3 milligrams of CBD isolate. Now, one is cheaper than the other, but if we look at the cost per milligram, we're more than doubling our cost per milligram by buying a less expensive product. What this boils down to in many cases, folks, is you get what you pay for. So just because a product is less expensive doesn't necessarily mean it's equal in value, equal in quality, or equal in quantity. So pay very close attention to your nutrition labels, look for independent third-party lab results, and make sure that you understand what you're trying to get. Are you trying to get an isolated cannabinoid like CBD? Are you trying to test out all of the cannabinoids but avoid THC? Or are you trying to get and take advantage of all of the cannabinoids? Regardless, communicate with your doctor. The information presented herein is for information and entertainment purposes only. Ultimately, it's up to you to make the right decision.